More than 26 million American adults have chronic kidney disease, and millions more are at risk and don't even know it. More than 526,000 Americans currently receive treatment for kidney failure, which includes 367,000 dialysis patients and 158,000 people with functioning kidney transplants, found on the National Kidney Foundation website. Chronic kidney disease, or end-stage renal disease, is the last stage of kidney disease, and many patients have to choose whether or not they want to do dialysis treatments for the rest of their lives or while they are waiting for a transplant. Today I will discuss what dialysis is, the two main types of dialysis, and how do you choose which one is the best option. So let's start with what dialysis is. Dialysis is a process that aids or takes the place of kidney function. The process of, according to the Medical Surgical Nursing Textbook, 7th edition by S.L. Lewis, they explain dialysis as a process which aids in the cleaning of blood by removing waste and excess fluid that the kidney normally gets rid of but is not doing properly because of the disease. The kidney is responsible for removing waste from the body, maintaining electrolyte balance, and regulation of blood pressure and the release of certain hormones, found on the National Kidney and Urologic Diseases Information website. Kidney function has to have had decreased to 10 to 15% of normal function in order to qualify for dialysis and to help receive payment for it. Some people will only need dialysis temporarily because of acute kidney failure, which usually results from trauma or severe illness that affects the kidneys. Diabetes is the #1 cause of kidney failure in the U.S., and along with high blood pressure accounts for nearly 85% of new cases of kidney disease, according to the National Kidney Foundation. There are two main types of dialysis. One type is hemodialysis and the other is peritoneal dialysis. According to the DaVita dialysis website, hemodialysis is normally done in the dialysis center. The process involves surgically implanting a port, which is used to remove the blood from the patient into a machine that filters the blood and the waste and excess fluid out and returns the blood to the patient, the clean blood to the patient. This process typically takes about 3 to 4 hours and has to be done three times a week. Peritoneal dialysis is another form of dialysis that uses the patient's own abdominal cavity and the peritoneum as the filter for the waste. A dialysis solution with differing levels of glucose that helps pull the waste from the blood and the body and excess fluid is put through a catheter that's also surgically placed in the abdomen, and the dialysis solution sits for a specified amount of time depending on what needs to be removed, and then the fluid from the abdominal cavity is taken out through that the same catheter into a bag and disposed of. Peritoneal dialysis can be done at home or while somebody's working. It has more options and gives the person more freedom to eat, because hemodialysis, you have a stricter diet than the peritoneal dialysis. So how would I choose which treatment is best for me? Well, the main way to determine which treatment is best is to consider these questions. Do you work? You have to have time to go to the dialysis center, or you can even do the peritoneal dialysis while you're working. Do you travel? Some places offer dialysis in other cities, but if you're going somewhere that doesn't have a dialysis center, then peritoneal dialysis might be a better option because you can take the fluid and the stuff you need to do your own dialysis treatment. What are your favorite hobbies? Are you compliant with your medications? Because each dialysis patient has their own medications that they need to take depending on their blood levels and what kind of disease or how far advanced their disease is. And do you accept the responsibility for your care? Obviously you would have to have be more responsible if you're doing peritoneal dialysis than you would hemodialysis, where somebody else does the process for you. The cost of treatment can be a factor in the decision also. According to dialysis nurse Jessie Hillary, the cost of treatment is very expensive. The average cost starts around $30,000 a year, but more realistically is around $75,000 a year. Medicare will usually pay 80% of the cost if your kidney function is 15% or less, and private insurance or self-pay will pay the rest. Dialysis is not easy, and weighing the pros and cons of each type of treatment with your lifestyle is necessary to have a more successful outcome. Amy Cox, a dialysis tech at DaVita Dialysis in Springdale, says that many patients suffer from depression and or choose not to have the treatment because they cannot deal with the diagnosis and the thought of having to be tied down to a machine for the rest of their lives. Today I've talked about what dialysis is, the two types of dialysis, and how a person would choose what type is best for them. Dialysis is a life-saving process that allows many people with kidney disease to have a normal life. It is very hard to hard diagnosis to accept, but having dialysis as an option can make it a little bit easier. Each year, more than 87,000 Americans die from causes related to kidney failure, according to the National Kidney Foundation. One patient I spoke with, initial VB, says that she just had to accept the diagnosis and do dialysis because she's 45 years old and has a 2.5-year-old son that she has to take care of. Many patients are like this person and can find great motivation to have dialysis treatments. So if you'd like more information, you can visit the DaVita Dialysis website or the National Kidney Foundation website. Local dialysis clinics can also give you information if you would like to.